illness that's caused by a novel coronavirus has become a pandemic, which means many people should expect to have this around the world. Earlier in this video series, we talked about the change survival behaviors and the links of preventing the spread and how to prepare for specifically COVID-19 issues, and then recognizing those signs of infection early so that we can respond effectively in reducing the spread and knowing when we need help. In the last video, we talked about what first aid is and its appropriateness to help people to be comfortable and to access emergency services when complications from COVID-19 happen, specifically with difficulty breathing. In the last links of the chain of survival, we addressed some of the simple means of supporting someone with COVID-19 and the role of advanced care. If this is a communicable disease, your COVID-19 action plan should have included how and where you would keep the infected person comfortable and isolated. In general, follow these basic rules for fever. Keep the person warm and rest as much as possible. If you or they feel like resting, rest, but do it in isolation. Take in plenty of fluids. For fever, take acetaminophen in normal doses. Check the label on your bottle. If a cough is persistent, humidification and drinking lots of fluids helps to moisten and loosen up sticky mucus or just moisturize the system. Non-prescription drugs designed to suppress cough are occasionally helpful. If you use an inhaler, you might need to use it more often. If your throat is sore, gargle with warm water, and half a teaspoon of salt in a half a glass of water. Use a vaporizer in cans of evaporating water or a steaming tub or in the shower to humidify the air that you breathe. And drink lots of fluid. For over-the-counter medications, follow the directions for age and check for updates from reputable sources like your health department or government website. But please keep this in your mind. Difficulty breathing or persistent temperature elevation of 103 to 104 are all danger signs. You need to call for help immediately if this happens. For you as the caregiver, taking care of yourself first is going to be one of the best steps you have. And you're not being selfish because you're going to be able to help people longer and won't be helping transmit the virus. Because the disease is communicable, you're going to want to find others to support you while you're in isolation with the infected person. People who can deliver resources or help you psychologically during the ups and downs of 14 days of being physically separated will be super important. Practically, washing and disinfecting surfaces, clothing, and other areas in your home will be important. This is going to also require you to isolate the person from others. Putting a face mask on the person who's showing the symptoms of COVID-19 will help prevent the spread. And using a face mask yourself is going to help protect you when you're in that close proximity. Also consider isolating your pets as they may carry viruses between family members. And then we know that there can be complications, especially for people who have underlying diseases, maybe just weak from old age. So difficulty breathing or shortness of breath or those complications will be important to recognize early, and you want to call your emergency number, generally 911 in North America. The first aid app from the American Red Cross can be helpful in knowing when to call for help or seek advanced care for other emergencies. Again, COVID-19 should not be an excuse for staying at home in a life-threatening emergency. Call your emergency services early. Just knowing the chain of survival isn't enough. Each link relies on actions by you and others to survive COVID-19 in a communal experience. Knowing your needs and your resources for yourself, your family, and your neighbors will improve your chances for staying healthy and recovering faster when the coronavirus arrives. This is our time as citizens to make a mark in history on what a global pandemic can do to unite us and build healthy relationships. Stay healthy, everyone.